always have the same problem. One of them is how to rebel. They have now solved this by defying their parents and copying one another.
Sometimes we young people, there are many things that come our way and we really want to try everything.
Us as African young girls, what the challenge we are facing is the challenge of fear.
All these contribute to the vulnerability of adolescents.
And adolescents are really busy. Sometimes they forget about their own health because they're extremely busy.
We are mindful as a kingdom that we are surviving in what we call a celebrity-driven generation.
We as parents, if we cannot take this into consideration, things can continue to be twisted out of context.
You can hardly be in position to reach the younger people of this country unless you go where they are.
You don't have to yell at an adolescent. You do not have to provide corporal punishment to keep them in a straight line.
So how are you going to reach them? If you are going to impact them, you have to go where they are.
Peer To Peer Uganda and various partners convened the second National Stakeholders Dialogue on Adolescent Health 2019 at Imperial Royale Hotel in Kampala. The dialogue was conducted under the theme Access to Holistic Healthcare Services, the need for multi-sectoral collaboration in popularizing the universal health coverage agenda to reach and/or engage adolescents.
This is a platform that we specifically identified for the adolescents and young people. The young people and the adolescents didn't have enough space to amplify their voices. Such platforms should be an opportunity for all of us as young people to challenge ourselves, to think deeper about the issues that affect us as young people, and also to take on the responsibility and realize how much we have to do as we, the young people who have got the opportunity to celebrate such platforms.
The second National Stakeholders Dialogue on Adolescent Health purpose was to provide a platform for a range of stakeholders within the country, such as young people, government ministries and agencies, non-governmental / civil society organizations, communities, academic and the private sector, as well as partners and donors. The stakeholders came together to learn, discuss and take steps towards argument on environmental issues across the board.
We must come to terms and accept that these things happen. So we are trying to reach them using kingdom initiatives, via sports, via coronation, via official kingdom functions, to give them a gentle part of the path that you can live a better life. You have got a price tag on you. There's a reason as to why you should be alive. Please, can you change and start moving otherwise?
The second National Stakeholders Dialogue started with a pre-adolescent dialogue event that reviewed Uganda's progress towards the universal health coverage and analyzed the status of the critical health infrastructure needed to sustain progress towards the universal health coverage for adolescents. The adolescent representatives and youth leaders, comprised of both girls and boys from primary and secondary schools in and out of school, and youth champions from across Uganda, who convened in Kampala at Imperial Royale Hotel to discuss about issues that affect adolescents, who came up with a communique to share their needs and recommendations to policy influencers and makers.
Each of us here has rights, and people in schools maybe should be taught their rights. Some of us don't know our rights, and now we should say no to or yes to.
So young people in this house, you never get to know everything, but always have a goal, have an objective, and have a mission in life.
The dialogue was one of its kind and very informative, as submissions from the panelists served the purpose of the panel by committing themselves to improve adolescent health.
It's important for us all as key stakeholders to bring harmony in strategies, to be able to deliver a range of quality healthcare services to all adolescents with no exposure to financial hardship, as other speakers have alluded to this.
The biggest problem we are very silent about is the social breakdown of our families. Parents are rushing to move out, leaving these teenagers, and yet we come back to bring them. The entire focus is towards money everywhere. Can we go back slightly to our roots? How did we come up?
If these are done, then we can try to address the issue of adolescent health. The state should establish or open up more youth-friendly corners in rural areas. This came up very key, so it should be a voice of all of us that these youth corners need to be taken down there.
Many lessons were learned to ensure free and easily accessible services for adolescents in order to move forward the universal health coverage agenda.
The donors must understand that adolescents deserve programs that are focused on them because they have unique needs.
During his speech, Dr. Richard Mugahi, the Assistant Commissioner Adolescent Health at the Ministry of Health, emphasized the consumption of information gathered from this stakeholders dialogue to be taken on by various stakeholders to prioritize and meet the health needs of adolescents and young people as an essential component in achieving universal health coverage.
As the Ministry of Health, we are mandated to coordinate all efforts that are geared towards addressing the health concerns of young people. We are going to work as a multi-sectoral team to make sure that all these factors that are predisposing or making our adolescents and young people vulnerable have been addressed.
Partners, once again, I want to thank you for making this happen by joining hands with Peer To Peer Uganda. We do not have words to thank you enough, but only to say that you keep up the spirits.